Canadian healthcare system. In this third part, we're going to examine healthcare in the United States. Healthcare has been a controversial and contentious political issue in the U.S., even more particularly after the election of President Barack Obama. Reform of the American healthcare system was high on his political agenda. Obamacare, as this effort came to be labeled, was seen as a centerpiece legislative achievement for the president, at least in the view of his supporters. To his detractors, Obamacare was a horrific, bureaucratic, misguided, even fascist government intervention in the direction of socialized medicine. Healthcare in the United States is complex. As we'll see, governments do certainly play a role in the American healthcare system. But for the most part, the facilities delivering healthcare are owned and operated as private sector businesses, with some hospitals run as nonprofits and others operated to generate profits. The key difference in how the healthcare systems work in Canada and the United States relates to health insurance. As we've seen in the previous part of the lecture, Canada has a universal system of health insurance coverage. Funding from the federal, provincial, and territorial governments ensures that all Canadians have access to medical care, hospitalization, visits to family doctors and specialists, diagnostic testing, for example. In the United States, certain groups are also entitled to government-funded health care. So to begin, let's look at these sorts of American healthcare programs. Medicare was introduced in the mid-1960s during the presidency of Lyndon Johnson. It provided health insurance to seniors aged 65 and older, regardless of their income or medical history. Before Medicare, some 35% of American seniors went without health insurance because they couldn't afford premiums that were sometimes triple the price paid by younger people, or they simply couldn't get an insurer at all. Younger people with disabilities were also provided with coverage. Around 50 million Americans are covered for health insurance through Medicare, but it's important to note that the program doesn't necessarily cover all health care charges, and individuals do sometimes require supplemental insurance if they don't want to pay out of pocket for certain expenses. Medicaid is another program through which American governments provide funding for health care. Targeted at families and individuals with low income or limited resources, Medicaid is funded by both the federal government and state governments, but is managed by the states. Each state has considerable discretion to decide who is eligible, and the states are not required to participate in Medicaid, although in fact all of them do. As part of the Obamacare initiative, more formally known as the Patient Protection and Affordable Care Act, eligibility for Medicaid was widened, and federal funding of the program was increased. According to that law, all U.S. citizens and legal residents with income up to a given percentage of the poverty line would qualify for coverage. Overall, about 60 million low-income Americans received coverage under Medicaid. The American Supreme Court did rule, though, that individual states did not have to comply with the widening out of Medicaid eligibility under Obamacare if they chose to continue to receive federal funding at levels that existed prior to the Affordable Care Act. You can see from the map here which states are expanding, not expanding, or are still debating the expansion as of 2014 at least. There's also a children's health insurance program funded jointly by the federal and state governments to provide health insurance to uninsured children in families with modest incomes, but who are nonetheless earning too much to be eligible for Medicaid. About 8 million children benefit from this coverage. Finally, healthcare is also provided to veterans, active duty military personnel, and their families through the Veterans Administration and the military health system. So, what we have in the United States is a patchwork of different government programs, often cooperative between state governments and the federal government, that provide health insurance to very targeted groups. For everyone else, health insurance must be acquired privately. Around 60% of Americans have access to such private insurance through their employers. The quality and comprehensiveness of this coverage varies widely, and the contributions employees are expected to make towards the coverage also depend on the employer. Moreover, the number of employers actually providing access to insurance through the workplace is in fact declining. Of course, if you're self-employed or you're unemployed, you're out of luck in trying to secure coverage this way. You have no choice but to purchase insurance on your own. Around 50 million people in the U.S., or about 15% of the population, simply do not have health insurance. The reasons given for this vary considerably. Some people are just temporarily without insurance. That's not the case for most of the nearly 50 million, though. As the cost for insurance premiums increase, fewer employers are providing health insurance as a workplace benefit. Other employers are managing the increased costs by requiring their employees to make larger contributions towards the coverage. Some people decide they are healthy enough and deliberately choose to go without coverage. Others, very sick, have already been rejected for coverage by insurance companies.
When Austin was over, he told me he had an ear infection and he couldn't hear out of one ear.
This category, those affected
So
by
I told him that if I had a penis, I would fuck it out for him.
To use the insurance terminology,
He was like laying here, and when I said it, he slowly turned like this and looked at me after. He was like, what the fuck? And then he was like, that's so romantic. And like, I agree.
While about a third are actually in households with income greater than 50,000.
Questionable things sometimes, and
People of Hispanic origin are the most affected by
I do questionable things?
I thought that about a third of Latinos were uninsured.
Hi, you
and
never came back.
Variation as well. As you can see from this map, people in the southern United States are more likely to be uninsured.
I'm stress eating now.
The rising cost of
Look at all my
healthcare
cats
in the
and
United
my...
States, together with this large number of
If I were to
uninsured
stress and
Americans,
eat something,
we're at the root of the Obama administration's efforts to overhaul the U.S. healthcare system.
what is that?
Again, while everyone tends to just call
No.
this Obamacare, the official name of the legislation is the Patient Protection and Affordable Care Act, or PPACA, sometimes just ACA.
That's a different one.
We'll end this part of the lecture by quickly looking at the provisions and the implications of this effort to address healthcare in the United States. The PPACA incorporates a number of provisions, all aimed at trying to rein in healthcare costs and at reducing the number of uninsured Americans. The various provisions were complicated, but a few of the key ones are in fact I think worth noting. First, it stops insurance companies from denying coverage to people on the grounds of most pre-existing conditions and requires the premiums charged by the companies are equitable, allowing for differences on the basis of age or where people live, not gender or those pre-existing conditions. The Act also sets minimum standards for such health insurance policies. Next, what is known as the individual mandate requires all Americans who are not covered by employer-provided insurance or some public insurance scheme to purchase an approved private insurance plan. If they don't, they must pay a penalty. The Act also established online health insurance exchanges on a state-by-state basis. Websites allow Americans to compare the various plans provided by insurance companies more easily, and then applications for insurance and government subsidies are incorporated into the online exchanges. This was done all in an effort to make it easier for Americans to meet the requirement to purchase insurance. And the Act provided federal government subsidies, which vary based on income levels for those who purchase their insurance through these exchanges. Passage of this Act was incredibly complicated, and while some Democrats opposed President Obama's efforts, it was largely the Republican members of Congress who led the charge against the PPACA. The act made it through the Senate with a vote of 60 to 39. All the Republicans voted against it. In the House of Representatives, the bill was passed with a vote of 219 to 212. Again, all the Republicans voted against it, and so did 34 Democrats. It's difficult to gauge wider public opinion on what is really the most significant reform to American health care in nearly half a century. Particularly while the act was moving its way through Congress, Americans seemed more negatively disposed to its provisions, even if a majority also believed that some sort of healthcare reform was in fact necessary. There's also evidence that opinion was divided along racial lines, with minorities more likely to be in favor of the act in comparison with white Americans. Younger Americans were also more likely to agree with the act in comparison with older Americans. Attempts to repeal the act began practically within hours of it being passed, but opinion in the United States today seems to lean much more consistently in the direction of making only slight changes to the act rather than repealing it altogether. It may well be that Obamacare will eventually come to be seen as just another element of the healthcare system, as Medicare and Medicaid did in the 1960s. The PPACA is interesting for us from a North American perspective because it incorporates the idea of universality. Everyone should be covered, but it retains significant elements of free enterprise. Private insurance companies are still front and center in providing coverage, and individual Americans, while required to ensure that they have insurance, they still have the choice in deciding who covers them. That's it for this part of the lecture. In the final part of the lecture, we'll do some cross-continent comparisons and talk a little bit about how Mexico features in the debates over how best to deliver healthcare in a North American context. We'll see you in part 4. Bye for now.